Welcome. I'm Dr. Dan Tomaszewski, orthopedic surgeon here at the Door Orthopedic Center. And I'd like to thank you for being here today so that we can prepare you for your upcoming hip or knee replacement surgery. Now, every year, hundreds of people come to the Door Orthopedic Center, not only from Door County, but also from across the region and even across the nation to seek joint replacement surgery care. And I think there are a number of reasons for that. We pride ourselves on quality, making sure that you have the best chance of the best possible outcome. We pride ourselves on service, making sure we're with you every step of the way. We also pride ourselves on preparation, making sure that you know what to expect along the way so that you're not surprised by anything before surgery, during surgery, or after surgery. Making sure that you have realistic expectations for what the recovery, the surgery, and the ultimate outcome might be. Now, I'd like to spend just a few minutes discussing some really important, some critical points about the surgery itself. Of course, surgery has come a long way over the years. The results are more predictable, the recoveries are quicker, complication rates are lower. But this is still a major surgery. And surgery always has a cost. Now, I'm not talking about financial costs, I'm talking about the costs of the surgery itself. Things like risk, rehab, recovery, and realistic expectations. When we talk about risk for this or any surgery, all surgeries have risk, unfortunately. Anything from damage to nerves and blood vessels, bleeding, infections, blood clots, heart attacks, strokes, even loss of life and limb. All of those things are possible with this or any surgery. Now, of course, hip and knee surgery has some specific risks related to the surgeries themselves. For hips, risks include limb length inequality, one leg being a little longer or a little shorter than the other. Dislocation, the ball actually popping out of the socket at some point in time after surgery. And issues related to the sciatic nerve, weakness, numbness, pain, tingling, drop foot, all of those things are possible after hip replacement surgery. For knees, the risks really have to do with the mechanical nature of knee replacement surgery. Knee replacement is metal and plastic, and as such, it can click and clunk, it can feel stiff, it can feel mechanical. It doesn't eliminate all of pain for all of time. Many people, up to 50% of people, never feel comfortable kneeling after knee replacement surgery. And so you need to be prepared for that. Everybody after knee replacement surgery has a patch of numbness about their knee, on the outside of their knee, because there's a nerve that's cut 100% of the time after knee replacement surgery. And so expect to have some numbness on the side of the knee. Additionally, realize these are mechanical parts. The parts that you were born with wore out over time. Mechanical parts are just the same. Just because you had your knee replaced doesn't mean it will eliminate all of pain for all of time. These parts can wear out too. They can loosen. You might need more surgery in the future. And so be prepared for that. Understand that that's a possibility with surgery. What about rehab? Many times people before surgery will ask me, well, am I going to be able to play tennis again, or go biking again, or swim again? And all of those things have much more to do with you than with the surgery itself. The surgery is just metal and plastic. It's giving you a good foundation, but it's not making you stronger or more flexible. It's not eliminating pain from other joints around your body. It's not making you young again. It's not the fountain of youth. Now, many people can regain a level of function, but that has more to do with you and you doing your rehab than the surgery itself. You have to put in lots of hard work with rehab, both with a physical therapist and, more importantly, at home on your own to get the best possible functional outcome. Of course, there's a recovery after surgery. You have to dedicate your life for a while to your joint replacement. If you have other things going on in life, or if you're not prepared to dedicate yourself for weeks or even up to months to try to get the most out of your joint replacement, well, you might be dissatisfied with it. This is still hard work. Last, I'd like to spend just a little bit of extra time discussing realistic expectations. Now, studies show that 10 or even up to 20% of people are persistently dissatisfied after joint replacement surgery, and there can be a number of reasons for that. I found, though, that probably the most common reason is just not having realistic expectations of life after surgery. Joint replacement surgery is intended to help chronic, disabling, arthritis-related pain and dysfunction. But that's it. It doesn't provide any promise or guarantee of any functional recovery. Am I going to be able to walk again, ski again, play pickleball again, bend over, twist, turn? All of that stuff has a lot to do with you, your age, other medical issues, other joints that are bothersome, your condition, your strength, what you do for your rehab. All of those things are out of the control of the surgery. And so you can't expect any of those things. You need to do this specifically for arthritis-related pain. We're trying to get rid of that pain. That's our goal. Now, it doesn't remove all of pain for all of time, of course. You can still have pain from other joints. You can have pain from sore muscles, a sore back, pinched nerves. All of those things are still present after joint replacement surgery. We're just fixing the joint that we're operating on. Okay, so that covers the cost of surgery. But what is joint replacement surgery? I've got a few models here that I'd like to show you to help illustrate what joint replacement surgery is. This first model is a representation of a normal joint. The blue represents smooth articular cartilage, the stuff that you were born with, the stuff that lines the end of a chicken drumstick. It's smooth and slippery and it's well lubricated so that it moves smoothly. This next model is a representation of an arthritic joint. Notice how rough and irregular it is. The bone spurs, the pitting, that hurts. That's what arthritis looks like. Now, this last model is a representation of what a knee replacement is. Notice all that rough and irregular articular cartilage and bone spurs, all that stuff has been removed, and the end of the thigh bone has been resurfaced with metal, and the top of the tibia, the top of the shin bone has been resurfaced with metal and plastic. So that rather than bone grinding on bone, rough and irregular cartilage, you now have a nice, smooth joint. Again, this is a mechanical replacement for a biologic problem. It's not the same as what you had when you were 18. It can click and clunk, it can feel stiff, it can feel mechanical, but it doesn't have that intense, unremitting arthritis-related pain associated with it. Now, this next model is a representation of what a hip replacement is. Much like with an arthritic knee, a hip can become arthritic, where the cartilage wears off and becomes rough and irregular. A hip replacement is a mechanical fix for that. It's a new ball and new socket so that there's no longer bone grinding on bone. Now, both surgeries are done typically with an operative time of about an hour to an hour and a half, and both are done typically as an outpatient, meaning you go home the same day of the surgery. Occasionally, we do keep people at the hospital if there are any medical or social issues that we need to manage, but studies have shown that people tend to do the best. They have the best outcome, recovery, rehab, and smallest complication rate if they go home directly after surgery. And so that's our goal for the majority of patients. Now, sometimes people can be a little alarmed by that. Isn't it going to be painful? Aren't I going to have a lot of swelling and bruising? And the answer to that is, yeah, it's going to be painful, and there's going to be sleepless nights, and you're going to have swelling and bruising from your groin to your toes. All of that is normal, but staying at the hospital doesn't change that. And staying at the hospital puts you at certain risks that you don't have at home. Higher risks of infection and blood clots, higher risks of slower recovery and rehab. And so study after study has shown that the people who go home the fastest not only tend to have the best early outcome, but the best ultimate outcome after surgery. In addition, we use a number of different medications after surgery to try to mitigate your pain, to try to make it as manageable as possible. But we try to limit the exposure to narcotic pain medications. Again, study after study, and our experience tells us that the people who use the most heavy narcotic pain medication tend to do the poorest. They have the most difficulty with sleep after surgery and continued pain after surgery. The people who grind through it, who expect pain but manage through it, use all the other medications, use ice, elevation, distraction, meditation, all those other measures tend to do the best. Now, one tool that we have available to us for patients going through knee replacement surgery is a procedure called Iovera. That's a procedure that's done a week or two before knee replacement surgery, where we freeze up or numb up some of the nerves around the knee. We found in our study of our patients that patients who go through it tend to take about 25 or 30% less pain medications than people who have not gone through it. Now, not all insurances cover it, and not everybody wants to go through that procedure. It does cause pain. There's bruising and swelling from that procedure itself, but we consider it an investment. There's some pain before the surgery so that we can help pain when it's at its worst after surgery. Now, I'd like to end this with a heartfelt expression of gratitude from me to you, both patients and coaches, for your time and attention today. Rest assured, you have an entire team of dedicated professionals working tirelessly behind the scenes to try to make this process as smooth and as successful as possible. But ultimately, the most important factor for your satisfaction with your recovery and your ultimate outcome is having realistic expectations of the recovery and the outcome. Surgery is not perfect, and there are costs to surgery. But if you understand that now, if you realize that now, then you're not going to be surprised or disappointed in the future. Now, this video might make you a little nervous or apprehensive. And if so, I've done my job. There are no guarantees or promises with this or any surgery. But I also hope this empowers you to know what you have ahead of you. Now, if you're ready, let's go get it. Thank you again for choosing the Door Orthopedic Center.